Hi guys, today we're going to be talking about hypochondriasis. In this lesson, we'll cover the symptoms of hypochondriasis, risk factors, and treatment options available to patients diagnosed with hypochondriasis. So what is hypochondriasis? Really the name that you're probably most familiar with is hypochondria. What hypochondria is hypochondriacs, they have an excessive, sometimes unrealistic um, fear of having a serious disease to the point that the fear becomes obsessive. In order to be diagnosed with hypochondriasis, the fear has to persist for at least 6 months or more. Okay, this is despite any negative medical diagnoses. Also, know that while the fear has to persist, the disease the person is afraid of can actually change. So, if you're not familiar with the DSM-5, it's the American Psychiatric Association's Manual for Mental Disorders. Hypochondriasis has actually been named in the fifth revision as illness anxiety disorder. Um, what that is, it's defined as a somatic symptom disorder, which basically manifests as physical symptoms of an illness without actually having that illness and can't otherwise be explained. So symptoms of hypochondriasis you may have seen before in family members or friends. We like to label people as hypochondriacs as soon as they begin revealing that they might have a certain disease. Like, so for instance, I have a family member that we lovingly but very seriously call doctor because anytime you say something doesn't feel right, she tells you exactly what you have. And she could be wrong, but that's her diagnosis. Someone with hypochondriasis does this to themselves daily. Okay, they experience very exaggerated disease symptoms of the disease that they think they have, likely with other symptoms caused by the stress that they're feeling from worrying about it, like weight changes, GI distress, fatigue, for instance. These are people that you want to stay away from Google because they already have a disproportionate anxiety about the symptoms. And I'm sure that you've seen that can get worse if the internet validates their thoughts, right? So there are two types of hypochondriacs as well. Those that are always at the doctor's office or hospital looking for the help with their illness, and those who avoid doctors at all costs because they're afraid of being right. Now, hypochondriacs even go to the extent of sometimes asking others to check their symptoms to validate their fear. And they'll ask questions like, oh my God, am I sweating? Oh, feel my head, is it warm? Oh my, everything is just exaggerated. So what causes hypochondriasis isn't really known, but there are some risk factors that have been identified to include poor coping from a major stress or loss, a history of another mental disorder such as OCD, depression, anxiety, maybe. Because really when you think about it, there's a lot of OCD and a lot of anxiety involved in this disorder. A history of childhood trauma, or even a history of family trauma or family history of hypochondriasis. Now, just FYI, the major loss could have been a loved one to the same disease the person thinks they have. So take cancer, for instance. If you have a family history of cancer and you lose those close to you to that disease, that can actually be the starting point to the fear of having it. Okay. So I'll use myself as an example. I have a family history. I have lost those close to me. I could potentially begin to feel like I have it too, just because of those losses. Okay. Doesn't have to be that specific disease either. If a male family member of mine had prostate cancer, knowing I don't have a prostate, I could turn that fear into having any other type of cancer. So the treatments for hypochondriasis vary from therapy all the way up to medication and overlap as well. So depending on how severe the diagnosis is, a person may be receiving different treatment modalities at the same time. So you have cognitive behavioral therapy, which focuses in on changing a person's behaviors, thoughts, and emotions. Um, and developing healthier coping strategies to help maintain those changes. Behavioral stress management and complementary and alternative therapy. Those are additional treatments that teach healthy coping and relaxation techniques like meditation and yoga. On the medication side of treatment, you have SSRIs. Um, they're usually the go-to option to treat underlying mental health issues. Like I said earlier, anxiety, depression, OCD, those can sometimes be risk factors, and they could also be potentially underlying issues. So by prescribing medications like Prozac, we're actually treating those illnesses and minimizing the symptoms that are exhibited in hypochondriasis. So some key points to think about. Don't leave this lesson thinking Googling your cold symptoms is a sign of hypochondriasis. Just remember that this is a disorder where the fear of the disease is actually a very irrational and obsessive disease thought. It's the constant thoughts of the disease are actually create the symptoms of it, which is what makes it so volatile at times. Those symptoms are often more often than not more exaggerated and made worse by the constant stressing, so it could potentially look like the person is truly sick. Again, we don't know what the true causes are, but mental health history can be a key factor, and it can be making the situation much worse. We discuss other risk factors as well, so check your patient history for possible links. Finally, treatments for hypochondriasis vary. While we can medicate rather to treat what's behind the disorder, we often try managing coping strategies and outlooks first.
Thanks for watching another nursing.com lesson. Click the link below in the description to watch thousands more lessons over on nursing.com. Also, be sure to hit the subscribe and the little bell to make sure you're reminded when new lessons come out. And if you want to just keep watching more lessons, go ahead and click this video over here to continue learning. Like we always say here at nursing.com, happy nursing.